everyone, this is Shannon Veronica Know Everything, here today with Antipsychotics. I just wanted to remind everyone, comment below, we're here on spring break, hustling, we do it for you all. So today we're going through first generation and second generation antipsychotics. They're also called typical and atypical. They're typical first generation because they're the older ones, we kind of discovered them real early on. Whereas the second gen, these are used, the atypicals are used much more frequently now. So you'll also see these abbreviated as, so atypical and then SGA, second generation antipsychotics. So starting with the first generation antipsychotics, the mechanism of action is to block D2 receptors. So I remember this by a blocked D2er. Symptoms treated, so mostly it treats the positive symptoms. So when I say positive symptoms, think of the crazy ones, like hallucinations, delusions, those kind of things. We're not allowed to say crazy, I meant crazy. And then it actually worsens the negative symptoms, so that's going to be like your avolition, things like that. So your like lack of desire to do things. So really think first generation, we don't use them that much anymore because they really only hit the hallucinations, delusions, positive symptoms. Moving on, the side effects of first generation antipsychotics. All of these are the opposite of the actions of dopamine. So basically when you have depleted dopamine, we're blocking it. That's essentially like we're inducing Parkinson's in patients because Parkinson's, or old people shuffle around, that's because they have deficiency of D2. So here we get the extrapyramidal symptoms. So we'll do another video, but remember hustle, rustle, and muscle. And then tardive dyskinesia, that's going to be the thing with the mouth, that thing. And then hyperprolactinemia, so dopamine helps keep prolactin levels down in the body. So when we block dopamine, we get a lot of prolactin. So you can see patients who are on like all these old meds that have like gynecomastia, things like that. And then another thing we can see is NMS. This is neuroleptic malignant syndrome. Basically, this is when you are blocking all the dopamine, something can go wrong in the body and you get a very high temperature and muscle rigidity. So just remember the fever, NMS related to first gen. Moving on to the meds that are first generation antipsychotics, they can be divided up different ways. On the PANSS prep rolls, you'll see it divided based on their categories. One is like phenothiazide, I don't know. But for the purpose of this class, we're dividing them up on potency. So the low potency meds is chlorpromazine, brand name Thorazine, and Thioridazine, which is Melorel. Nowadays, we're only using these for nausea in very low doses. So if you remember chlorpromazine for nausea. High potency, we still use some of these. Everyone knows Haldol, fluphenazine, and perfenazine. Haldol we use just for your like sedating agitated patients all the time. You'll hear B52, it's like 5 Benadryl and like 2 Haldol, 2 milligrams, something like that. But Haldol used very frequently. So moving on to the second generation antipsychotics, or the atypicals. The mechanism of these is they also block dopamine, so we see this blocked D2er, as well as they block serotonin, different 5-HT receptors, you'll see the blocked serotonin. These treat positive as well as negative symptoms, and that is the reason that we use them more than first generation antipsychotics. Big side effect, metabolic effects. So remember our metabolic syndrome is glucose, obesity, HDLs, triglycerides, and one other thing. But metabolic effects you have to monitor for very closely, huge role with PCPs. And then moving down to some of the specifics, we have a lot, but the more you look at them, they kind of come about as being intuitive. So aripiprazole or Abilify, this is actually really common. I think a lot of primary care providers are more comfortable with this drug than some of the other ones. My aunt was on this because it can also be used for depression that doesn't respond to a lot of meds. So it's this one is very different. You have to remember it's a dopamine partial agonist. So it's not a blocked D2er. So remember aripiprazole actually works with the dopamine. The reason for this is really confusing, so don't worry. With this, we have to watch for impulse control. So I always remember this because my aunt on Abilify did a lot of shopping. So we have to make sure patients aren't shopping, gambling, things like that. It just makes you more impulsive. Less weight gain. My aunt lost weight while she was on this, so that's Abilify. Acenapine, this is one of our newer drugs. There's less weight gain. And then clozapine. This was the first drug created for second generation antipsychotics. So remember, clozapine, watch closely for agranulocytosis. Clozapine is no longer used because you have to enter your patients into a register, like a national register, and follow them really closely for this agranulocytosis. So just know that's a really easy test question, boards question, but it's not used. Iloperidol, not for hepatic impairment. So just remember, if your patient is hepatically ill, do not give them iloperidol. Lorazepam, I think this is one of the newer ones, has a really weird thing. Take with 350 calories of food. So, I don't have a way to remember this. Lorazepam.
Eat a Luna
Eat a
protein
Luna
bar.
About 3 of them, 3 Luna bars. And then you can take your lorazepam. Olanzapine, obesity, the O's, that's the biggest obesity. This is Zyprexa. We hear this, it's more common. And then, we didn't write it, but it's also something with DRESS syndrome, and I can't remember what that is, but you can remember obesity, DRESS. The next two, I think they might be like enantiomers or something, they're very close. Paliperidone and risperidone. They both are, so they give high prolactin levels and extrapyramidal symptoms. So the way to remember this is that they act like first generations. So when you think of risperidone, you might think that's kind of more classically like first generation antipsychotic basically. However, it falls into this category because of the serotonergic blocking. You can remember risperidone gives rise to a pair of tits because the high prolactin levels. And then the next two, quetiapine and ziprasidone. Quetiapine, Seroquel, you probably heard of this. These two both have QT prolongation. And then quetiapine, quiet time, it's very sedating. So, to review, we have antipsychotics, first generation typical, second generation atypical, D2 blocker, and then D2 and serotonin blocker, except for aripiprazole. First gen, we get the tardive dyskinesia, extrapyramidal symptoms. Second gen, we get the metabolic effects. Thank you for tuning in.